The class I'm teaching this summer, the course title is Medical Humanities 238, so it'll count as one of the 4 electives you need to pick up a medical humanities minor at Rice. And the title of the class is, as I last checked, Mental Health in Literature, Film, and Social Media. And so, in a way, the class is conceived as a history of the concept of mental health and by extension, mental illness. So we'll trace emerging and changing conceptions of what mental health and illness look like through about from the 1600s to the present day, and look at dramatic, novelistic, filmic, etc., a bunch of different mediums that reckon with changing conceptions of mental illness. So I'm pretty sure we're going to start with Hamlet, and we'll think about kind of early modern Renaissance conceptions of madness. We'll move forward through the Romantic period. We'll look at Goethe's Sorrows of Young Werther, Poe's short story The Black Cat, and then we'll move into later 19th century theories around nervousness and anxiety, and we'll read The Yellow Wallpaper. The big change then is the advent of psychoanalysis in the early 20th century, and I'm going to be looking at that primarily through films and primarily through Hitchcock's films. That takes us through the early part of the 20th century. Look at some J.D. Salinger's short story, A Perfect Day for Banana Fish. We'll read probably Sylvia Plath's The Bell Jar. And then as we move on to the present, we'll watch, I think we're going to watch American Sniper and think about post-traumatic stress disorder. I'm going to want to watch Lynch's Mulholland Drive, Donnie Darko, Fight Club, look at some dissociative personality disorders. And then the kind of caveat at the end of the class is to think about the role that social media plays not only in causing and alleviating mental health disorders, but as a substitute in some ways for the therapeutic and diagnostic process itself, and the way that what Freud and others have called like the confessional impulse takes shape through social media now.